Hi everyone, welcome to Top RN Academy. Today we are going to discuss a neurological condition, Guillain Barr Syndrome. Let's see what it is. It is also called GB syndrome. It's an autoimmune disorder that mainly affects the peripheral nervous system that result in complete paralysis of the body if not treated in time. So let's see what immune system does to our body. Our immune system is meant to protect the body against infections. The immune system usually produces antibodies if there is an infection and fight against this infection. But for some unknown reasons, sometimes this immune system attacks the body itself. This is what is happening in our condition GB syndrome. It attacks the neurons that carry signals to the brain. So, what is it doing to the neurons? The neurons got an outer covering, protective covering called myelin sheath. This autoimmune response distracts the myelin sheath, exposing the neurons. So, the neurons are not able to pass the signals to the brain it is supposed to do. So that's how it distracting the neurons or prevent the neurons from sending signals to the brain. Yeah. So what happens if the brain is not getting signals? The brain doesn't know what to do. The brain doesn't know how to move. It's not getting any signals. So let's see what are the causes of GB syndrome. Actually, the exact cause of this abnormal autoimmune response is unknown, but various researchers have found out that usually the GB syndrome is triggered after an infection, like a respiratory tract infection, like a flu or influenza virus infection, or a GI tract infection, gastrointestinal infection, that is severe diarrhea, which is especially caused by Campylobacter. Now let's move on to the clinical manifestations of Guillain-Barre syndrome. What are the signs and symptoms the body will present if the patient is having this condition? Yeah. As we know, as we discussed, the neurons are not transmitting signals to the brain because it get damaged or demyelinated. Yeah. So because the neurons are not passing signals to the brain, the patient will get paralysis. And what is the characteristics of this is it is called ascending paralysis, which is symmetrical in nature. Means it starts in the leg and going upwards. The paralysis start in the leg and it is symmetrical in nature because it's not one leg is affected, both legs are affected, and it goes up in a symmetrical manner. It goes up to the body, the paralysis. If it's not been treated, the paralysis can affect all parts of your body. And if it reaches the lungs, it can affect the diaphragm, it can cause respiratory arrest, no movement. The movement of the lungs will be affected, and respiratory arrest can occur, and the patient can even die. So, and also it can cause facial paralysis. For some patients, there may be some swallowing difficulties also because of facial paralysis. They may not be able to chew, they're not able to swallow. So, it affects the whole body actually. So, if the patient is being treated, being identified as GB syndrome, and it treated, uh, the patient can completely recover if it is treated in time. So let's see what are the treatments available for this condition. The first one is IV immunoglobulin therapy. We know it is an abnormal immune response triggered condition. So we are giving IV immunoglobulin. We are giving healthy antibodies to the patient to destroy these unhealthy antibodies or stop the working of these unhealthy antibodies. We are giving intravenous administration of immunoglobulins. This will stop the working of the unhealthy antibodies in the body. And the second one is plasma pheresis. Plasma pheresis means it is the body's blood is being circulated through a machine where the plasma and the blood cells are being separated, and a healthy plasma from a donor is being transfused into the patient. So this is called plasmapheresis. In both these ways, the unhealthy antibodies are being eliminated by the body with the help of these two therapies. So if it's been done in real time, in short time, the patient can fully recover, but it may take up to 1 to 2 years because most of them may have paralyzed the legs and arms. It takes some time to recover, but full recovery is actually possible. But in less than 10 percentage of cases, some residual symptoms will be left. Like, some of them have mild weakness in the legs when walking, if there is delay in treatment. But most of the cases, full recovery is possible if identified and treated in time. So, as a nurse, what are your responsibilities for caring for a GB syndrome patient? And you know that when a patient comes with a GB syndrome, you may can ask the history of the patient if they were having any infections, respiratory or GI tract infections recently, to get some idea about what might have caused the GB syndrome. They might have had some vaccinations, previous surgeries. You can take history about that. Then you know that the mobility of these patients will are reduced because they are paralyzed already, isn't it? Or maybe they have some weakness in the legs and arms, so they need protection or skin care. By repositioning and monitoring of the skin is the responsibility of the nurse. And some of them may have swallowing difficulties, so we need to arrange for tube feeding to maintain adequate nutrition of the patient. So these are the main responsibilities of a nurse in caring for the GB syndrome. So I hope you understood about GB syndrome. Thank you so much.